Hi, we are Group 22, and our program, Running to the Future, program planning for obesity prevention of low-income children in San Diego, is designed to decrease the incidence of obesity in elementary schools students in low-income schools in San Diego. Lower-income neighborhoods are more likely to have overweight children due to the culture and demographics that they are surrounded by. According to the CDC, obesity in children has more than doubled in the past 30 years, and in 2010, more than one-third of children were classified as overweight or obese. We want to prevent children from growing up to be obese so that we can prevent chronic health issues in the long run. By creating fun and unique ways for children to be active and healthy, while they are still young, they will be able to keep their healthy lifestyles and continue these healthy habits in the future. We have 3 study objectives. First one is by the end of 2013-14 school year, 85% of students will increase their physical activity during school hours by at least 50%. Our second objective is by the end of 2013-2014 school year, students will be able to identify 3 healthy meal choices. Our last objective is by the end of the 2013-2014 school year, 100% of families of participating elementary students will have incorporated physical activities into their daily lives. For our conceptual model, we chose the theory of reasoned action. This theory uses attitudes, beliefs, intentions, and behaviors to present a conceptual framework. More specifically, this theory states that an individual's intention of achieving a behavior depends on their attitude towards the behavior and their subjective norms associated with the behavior. So let's take a look at our model. Whether a child will be physically active depends on their attitude towards physical activity and their family support regarding exercise. Our program aims to combat negative attitudes towards physical activity by using incentives to reward participants who are physically active. Similarly, to create a positive subjective norm. The program will engage family members and ultimately create a positive environment for behavior change. Lastly, peer norms will also influence the child's intent to exercise. Our measurement for the study will be subjective. Surveys will be used before, during, and after intervention for both the students and parents. In order to participate in the study, both the students and parents must complete the initial survey. Parents will continue to receive paper surveys throughout the study, while students will have a verbal survey. Verbal surveys are beneficial when working with young populations that have different reading levels. But one limitation of verbal surveys is that they are timely and costly. Surveys will include a physical activity log and questions about eating habits at home. In order to increase our retention rate, gift cards will be used as incentives for parents to complete surveys. While at school, students will receive 1 physical activity ticket for every 20 minutes of physical activity they participate in. These tickets will be turned in at the end of each week and can be redeemed for various prizes. We will then use these tickets to determine another measurement tool to measure minutes of physical activity per week for each student participant. This program is based on a quasi-experimental design. We choose this program design because with our population, we cannot control all factors that may influence the validity of the study. For example, we cannot determine the control for puberty, age, or knowledge differences between grade levels. Additionally, the schools we choose will not be randomly assigned because they will be chosen based upon their location and their income. We will be using the federal poverty levels of residents in the communities to determine which schools are eligible for the program. We will be selecting experimental and comparison groups from communities that are at or below the FPL. We recognize that not randomizing could be a limitation to our study, but since low-income communities are at greater risk for childhood obesity, choosing specific schools is vital for this study. Thank you.